Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thank you all for joining us in the Veterinary Breakroom today. In the Vet Breakroom, Dr. Alyssa and I have short conversations about relevant topics in veterinary medicine. And today I decided to pose the question to Dr. Alyssa and see what she thinks about whether or not, as veterinarians and vet teams, we have an obligation or a responsibility to talk to our patients or pet owners about pet insurance. And obviously, there's a million and one directions we could go when I say we're talking about pet insurance. But today, I specifically want to focus on, like I said, I always have debated how much of that responsibility falls on us. Is there a moral obligation? So, I wanted to kind of discuss our thoughts on that topic. And I figured to kick us off, Alyssa, we can discuss, do you have pet insurance for your own pets?
It's a very good question. I do not have pet insurance for my own pets. I've never had pet insurance for my own pets. I am debating getting pet insurance because we do have 2 new puppies in the household, and so I am debating getting pet insurance for them. It's something that I traditionally have not felt was necessary. And I'll tell you, we've both been practicing a while. You've been out over 10 years. I've been out over 20 years. Early on in my career, I really didn't consider pet insurance a necessity. I kind of actively discouraged clients from getting pet insurance. I said, go ahead and take that money that you would have put towards a premium, a policy, your policy payment every month, and put that into, a high yield savings account or something like that, that is earmarked for pet care. And I thought at the time that was a better way to go. That is what I did personally for my own pets. However, I do find that, everything changes, and now practicing in 2024, the amount of things that we can do has ballooned. And along with that, the cost. And so I'm kind of rethinking that whole mentality and that plan that I have really followed for my whole life, and for the first time considering health insurance. So for my pets, for pet insurance. Yeah.
Yeah, I think you kind of hit on, I think, the reason why I wanted to bring this up, and that's because I have felt kind of the same shift in my mindset through the years, and I think that is because of a lot of changes in the veterinary industry. I think we've seen costs of services go up. We have seen, like you mentioned, the medical capabilities increase, and we've seen a lot of changes in insurance companies themselves and what they offer and the different options available. So I'm kind of right there with you, where early in my career, because I didn't feel very strongly about it, I certainly didn't feel kind of an obligation to bring it up in every new patient appointment. I, as of recently, am officially a pet insurance holder for the first time in my life. I have it for both of my dogs. Admittedly, it is because I'm now getting it at a reduced rate through our company. It's still an investment, so I certainly didn't consider it like an automatic decision just because of that reduced rate. And I still have gone back and forth a lot in my own mind about it and continue to do so. And yeah, it's hard to know. Like you said, I do feel like I traditionally used to say, it depends on if you're willing to maybe save up for that rainy day fund if your pet needs it. And I think the reason that I feel kind of that increasing level of anxiety and responsibility to bring it up to pet owners is maybe because now I do have it for my own pets, and I do feel like our pet owners rely on us for almost everything. It almost feels a little bit different than human patients. I feel like pet owners expect us sometimes to be able to deal with every facet of pet ownership and not just kind of that medical diagnosis aspect or that
Mhm.
preventive care aspect. Um, and so the challenge to me becomes we have 15 minutes with these new patients or a half hour, whatever the case might be. And do we have time to be discussing it with every patient? And where should they be getting this information? And I don't really know what the right answer is. Um, but I think it's an interesting concept to think about. And I also think that it's not just something we need to mention, but don't you feel like it's such a nuanced topic as far as
Mhm.
who pet insurance is recommended for? I don't think it's
Mhm.
something we can still make a blanket statement. I think it would be easy if I recommended it. If it was right for every situation, you could if there was one company, hand people a pamphlet, tell them
Mhm.
to sign up and be done with it. But it seems like it's such a nuanced conversation.
It is a very nuanced conversation, and it's a little bit difficult. A lot of times clients ask me, just like you said, what do you do for your own pet? And
Hmm.
that even, especially dealing with pet insurance now, that's a difficult, comparison. And I tell people this all the time. I'm like, it's a little, I have a different situation than you have because, working in the field, I do sometimes get things at a reduced rate, or I, um, it can be a tough conversation to when clients are asking you what you would do when you might not have ever been in that situation because maybe you would have caught a disease earlier or something like that. And so that can be hard, and I find that with pet insurance too, it's difficult for me to answer that question, especially some of the insurances now, they're not allowing veterinarians to treat their own pets. You can't be the treating veterinarian if you're going to, use the insurance or make a claim. And I understand where that comes from, from the fraud standpoint and everything. I get it. But we've had this conversation before where I prefer to treat my own animals. And if getting pet
Hmm.
insurance is going to limit me being able to treat my own animals, then it's not for me. And so that comes into, difficulty when I'm recommending it to clients because I really can't share my own experiences.
Hmm.
you know Going back to your actual question, was do we have an obligation to discuss pet insurance with owners? I'm going to kind of hedge that and say yes and no. All right. So I don't believe we have an obligation to, go through different companies and, recommend things. I do think we as veterinarians have an obligation, especially when a pet owner comes in with a new pet, a puppy or kitten or a recently acquired, older pet, to have that conversation about cost of care, cost of lifetime care. And it is really important to get them in the mindset that they're going to have to start thinking about that right away as soon as they get an animal. And I think that that will save them as well as, us, a lot of anxiety and angst in the future if we can have that open conversation that pet ownership is wonderful. We just did an episode about whether or not it makes you happier. I truly believe that, having pets in our lives increases our well-being, but they're also a responsibility. And so being open about the fact that that is going to cost money, and how, starting those conversations early, not when somebody comes in with a very, very sick animal and you're presenting them with $1,000 estimate for diagnostics, I think is our responsibility.
Yeah, I agree with your take on that because I do think cost of care is so important. It's just it impacts almost everything we do as much as we like to really not talk about it. I think we educate ourselves on all these medical topics and options and diagnostics and um all of that good stuff, but what does it come down to in real life? And I think so much of that is cost. So I do think we do ourselves a disservice and our pet owners a disservice when we don't bring that up early and often. And I don't think it's easy to do. But I do think it is important. And I think pet insurance is maybe part of that conversation, but not the whole conversation. And I almost think that's maybe a smarter approach to it too, because we can focus on what we know. We know that there can be high levels or high costs of care associated with pet ownership more likely than not. We know that pet insurance can potentially be a way to offset that, but it doesn't have to be a kind of a black or white recommendation, because I do think so many times it gets back to what you said about pet owners like to say, well, what would you do if you were me? And it's just like, that's not the scenario. Everyone's
Right.
finances are different.
Hmm.
Everyone sees pets differently, and wants to pursue a different level of care in the situation of maybe a significant life-threatening diagnosis. Um, you know, some people, I was joking with Alyssa earlier that maybe some people would have one pet that they would consider insuring over another pet. I said that jokingly as someone who currently has a favorite dog and a less favorite dog, we'll just say. But yeah, there's so much to consider. And then on top of that, there are so many different insurance plans. There's ones that cover the preventive care. There's ones that have a deductible based on a diagnosis. There's ones that have the annual deductible. And so I think that's where it gets really tricky. But I do like bringing it back to that cost of care conversation, because I know the times where I have felt guilt about like, oh, have I mentioned it to this pet owner? Have I not? Is maybe when the pet comes in down the road and they're sick and the pet owners either can't afford it or maybe outright say, I wish I had gotten pet insurance.
Hmm.
Um, and I wonder if there are any surveys out there. I think what I have noticed in my own experience is I feel like most people don't regret having pet insurance, if that makes sense. Where I
Hmm.
can kind of say, it's not for everyone, but in my experience, most people that have gone through with it have not regretted it. And maybe it's hard. It would be potentially a hard thing to regret, and maybe people that do quote unquote regret it aren't very vocal about it.
Hmm.
But I think that's one way that maybe can be helpful to phrase it. But I would be curious of a study of everyone with pet insurance and kind of
Hmm.
who has found it to be beneficial, and maybe those that wish they hadn't pursued it.
Yeah. Uh, I'm not sure, regret is the correct term. I definitely have had clients over the years, though, that have made claims that have been denied that,
Hmm.
I have questioned the reason for the denial, denied a particular, I don't even remember the company. So it's not even that I'm choosing not to say the company. I don't even remember the company because it was years and years ago. But, I had a bulldog and they insured the puppy right away. And the puppy got, a cherry eye, prolapsed nictitating membrane gland. And it was one of those things that was not covered because it was a breed predisposition or whatever they had said. And, that is one thing that I do think is our obligation. And I say to everybody when clients ask me about it is, read the policy very carefully. Read the
Hmm.
policy very carefully so that you know what is covered and what is not, so that there's no surprises, down the line. And there's good companies. There's good companies. I think also. So my question is, if it's not our obligation, is it anyone's obligation? So you brought up a very good point that your company subsidizes. They don't provide pet insurance, but subsidizes, pet insurance for your pets. There are companies out there that do provide as part of their benefits package for their employees pet insurance, and some of them aren't even, in the animal industry. Some of them are other big companies that have realized people would like this benefit and it's offered through their company. And so is it their responsibility or their obligation to tell them? Or what about, a financial planner? Is it a
Hmm.
financial planner's obligation to say, hey, do you have pets? Like this could impact your financial well-being if something happens, the same way they talk about auto insurance and home insurance and renter's insurance. So I think there's definitely other people, that could be involved in this conversation.
Yeah, absolutely. I like your point about the financial planning, because especially in this day and age where so many of us think of our pets as our children, they are a line item on the budget, so to speak. And I have to laugh because I'm now the proud owner of our like family finance spreadsheet and budget. And of course, when you're comparing me versus my husband, and who thinks that high number on the pet budget Excel sheet is worth it. Of course, it's me. So I was able to reassure him, this number may be high, but because it includes pet insurance, this number theoretically shouldn't get much higher, even in the worst case
Mhm.
situation. So I do agree that it comes into play when we're talking about financial planning. And yeah, it's tricky, I think, because I think pet insurance too can really help. And again, maybe we're getting beyond the scope of my initial question because there are so many facets of pet insurance that we can discuss. But I also think one of the big benefits is the way it can improve morale at the vet clinic, for
Mhm.
veterinary staff, and how, is that one of the answers to moral fatigue and passion fatigue and all of that, when we can provide care because these pets have insurance. So I think there are a lot of questions to be raised about it. And I do think it is good to mention to pet owners, but I think maybe the answer is, or at least our answer, Alyssa, is that maybe it's our responsibility to convey the costs of pet care, whatever that looks like.
Exactly. I agree.
So I'm sure there are a lot of different opinions out there, but that's our take on it. So, Alyssa, I think that brings us to our wrap up win of the week. Any
Wrap
wins
up
in
win
your
of the
world
week.
this week?
I'm gonna stick with the financing theme. So my
Okay,
big
good.
win, yeah, I'm gonna stick with the financing theme. So my big win is that, for people that listen to the podcast, I kind of have this hodgepodge of jobs. So, we host this podcast. I host the Clinicians Brief podcast. I've worked, for Clinicians Brief since 2015. I also still continue to pop into clinic several shifts a month, and I do in-home hospice and euthanasia. So all of those different jobs all have different methods of paying me, and tax season is right around the corner. And so my win of the week is that I did sit down, go through everything, got all of, signed up for all of my W-2s and tracked down exactly how much money I'd paid in taxes so that I have that all prepared for my tax person and I'm not scrambling at the last minute like I normally am. That was my win.
I'm really proud of you because that is what nightmares are made of to me. Anything involving taxes or finances or
Yeah.
any of that. I
It
I
it's so much because there's literally I can't decide what I want to be when I grow up, and so like
it's good to
I have
collect the
commitment
jobs.
issues. I have like 6 jobs.
I think that's good job security. If one goes away, you've got three others. Oh goodness. Well, my mini win of the week, Alyssa, is going to be similar to yours because I recently, like I mentioned as we were talking, I feel like neither Sean nor I are super into tracking our finances, but I did recently make this master Excel sheet that I'm very proud of. So anyway, I'm with you in that it does feel good to get some of that in order. But my big win of the week is that soon I will be headed to VMX, which is like, now that I'm what I consider an industry vet where I work with clinicians brief, I never knew behind the scenes of VMX what a big deal it was for so many of these veterinary companies. It's been really enlightening to see all of these, all of these industry companies and how VMX and then WVC in February are so important to the inner workings of the veterinary industry. So anyway, mostly I'm excited to go to Florida and hope that it's warmer than Ohio, but also excited to be a part of all the, there's a lot of drug rollouts and things that happen at VMX. So looking forward to that. And hopefully we can bring some new and exciting stuff to the Clinicians Brief audience. So
Yeah, I want to hear all about it when you get back.
yes, absolutely. Well, to our audience, thank you all for listening in today, and we will catch you all next episode. Thank you for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a Vet Medics production, produced by Alexis, Ussery, and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.